22 News I-Team series on drug shortages continues tonight. Now turning to the nationwide shortage of potentially life-saving chemo drugs. 22 News I-Team reporter Alana Flood takes a look at how healthcare providers are grappling with the shortage in our area.
While this shortage stretches across the country, I have a look at how the limited amounts of critical chemotherapy drugs are impacting cancer care in our area. Potentially life-saving chemotherapy drugs are on short supply, and it's affecting care in our area. It's a problem so acute it was recognized by the Biden administration just last month. The White House noting that there's a shortage of 15 cancer drugs due to manufacturing and supply chain issues.
If you were going to rate the shortage on like a scale of 5 being a critical shortage and 1 being no shortage at all, like what you're experiencing here locally, how would you rate the shortage?
Right now, I would say it is probably a 4. We only have a very small supply of one particular drug.
Pharmacy Director Michelle Kosowski said drug shortages are not uncommon in the healthcare industry. However, when faced with potentially life-saving drugs, it can get complicated.
Anytime there is a shortage, there's a risk of not being able to treat patients. Obviously, that is what we want to avoid, and we work to the best of our ability with creative solutions to make sure that doesn't happen.
There's always the ethical issues of who gets the drug that's available. It's supply and demand, as you said, and looking at what folks have for their disease, which ones need to be treated faster than others based on the aggressiveness of their disease. Those things played in, but it was really a difficult decision to sit down and try to decide who would get the drug. We were never in that position where we had to deny anybody.
Cancer patient Norman Hughes-Devinis said he was very concerned when he first heard of the shortage.
And I had wondered where in the chemotherapy I would be at, would have to be delayed for months or years if possible.
Hughes-Devinis has not had his medical care compromised, but feels for those who have.
I feel for them. I know what I'm going through, and that everything is here, so it's perfect for me, but there's a lot out there that are not as fortunate. I know that.
Healthcare providers here were able to mitigate the shortage by using a couple of different tactics. For example, they could switch up a patient's medication regimen.
What we did do was use drugs that were in the same classification but weren't necessarily that specific drug. There's also drug regimens where we could switch around the order to which we gave the drugs. So if there was a drug that wasn't available, we were able to do one of the drugs that was available first and do that second drug second. So that was able to work out, so people didn't do without, and they were able to get what they needed.
According to the FDA, the shortage started when one of the major manufacturers of chemo drugs, Accord Healthcare, a company that is based in India, had to shut down after problems complying with good manufacturing practices were found during an inspection. Now there is increased demand from other companies who make these kinds of drugs. I contacted some of the other manufacturers of these drugs, and Pfizer is the only one that got back to me. They stated they are increasing production by about 40% to meet increased demand. Working for you on the 22 News I-Team, I'm Alana Flood.